We've done a great job as an industry of capturing and making data available through interfaces. Now it's about drawing insights from that data and then using it to make real decisions.
Welcome to Unlocking Big Data, a series about getting trusted data to healthcare decision makers presented by HIMSS. In December 2023, HIMSS Market Insights conducted research with 100 healthcare leaders to understand perspectives on the use of data analytics platforms. Throughout the series, we'll present key data points from the research and focus on why these data points are important and how you can leverage these findings to support your healthcare organization's data initiatives. Today, I'm joined by Dr. John Halamka, president of the Mayo Clinic platform, and Michael Meucci, CEO of Arcadia. Welcome, you two. I'm very happy to have you.
Thanks for having us today.
And great to be here.
Thank you. Research tells us that healthcare leaders are most likely to agree that one of the most important things data empowers is allowing their organizations to improve the quality of care that they provide. They also universally feel that data platforms are critical for their organization's ability to adopt tech tools across the enterprise and to create a trustworthy data asset for their stakeholders. One of those rising technologies is artificial intelligence. According to our research, healthcare leaders and organizations with 15,000 plus employees say that they have plans to improve their analytics in the next 12 months to keep up with innovations in AI. So clearly we have a lot to talk about, everybody, and I'm glad you're here to dive right into it. So John, why don't we start with you? You have a new book called Refining the Boundaries of Medicine, and in it you actually talk about how we need to rethink and revision how we actually deal with healthcare. So talk to me about that and what technologies specifically you think are central to the transformation.
Sure. Well, let me answer it in two ways. So, Kate, what's the birth rate of most industrialized countries in the world? Less than 1.5.
Wow.
And of course, we all know you need 2.05 just to have parity because of infant mortality. So how is longevity going in the world? The answer is we're actually living longer. Okay, so if you live longer but no one's being born, who's going to care for all those elders? There's going to be an enormous supply-demand mismatch if we think of healthcare as a bricks and mortar facility with smart doctors and nurses. We're going to have to look at new ways, and that means AI-driven triage, who gets what care journey. And I'm not talking about rationing medicine. I'm saying right care, right place, right time. New models like care in the home. More continuous monitoring for wellness. Unless we do that, we will not deal with the demographic challenges ahead.
Do you feel this glaring statistic is something that's very well known that people are actually starting to work on?
Well, how about this? I don't know that people are looking at the statistics, but certainly in the post-COVID world, they're saying hiring and retaining and affording employees is hard. If you ask hospital CEOs what keeps them up at night, they don't say, oh, I need an AI algorithm. They say, my margins are negative, I can't hire the people I need, and everyone's burned out. So the problems are real.
I think you hit on something that's also really important. It's affordability. Technology is allowing us to democratize access to care journeys and patient-assistive devices and clinical decision support in a way that 5 years ago wasn't possible. If you look at the work that big tech, Google, Amazon, and Apple are working on to put personal health records in our pocket, allowing us to be better advocates, delivering real-time notifications around how we can modify our behaviors to live longer and healthier lives, I think that technology is really attacking not only access and reducing care disparities and also bias in care delivery, but it's also helping attack affordability, which we desperately need to as a society.
How about data analytics platforms, Michael? How is that helping with transformation?
Following on John's commentary, every hospital CEO that I work with is asking me, how do we get smarter about resource allocation? How do we make sure that we're putting our physicians, our extenders, our admin staff in the right place at the right time? How are we using technology most effectively to serve our patients better and deliver better health outcomes? And the data and analytics platform is the foundation. It's the traffic director. How do you take all of the inputs, draw insights from it, and then shift them out into the community?
Right, because now we have so much data, which we thought was so great in the beginning.
Correct.
We weren't using it well.
Exactly. And we've done a great job as an industry of capturing and making data available through interfaces. Now it's about drawing insights from that data and then using it to make real decisions.
Well, and maybe just another comment on that. If we ask how fast do innovations disseminate in American healthcare, you probably know from Clayton Christensen and others you've read, 20 years. So what can a data analytics platform do? Take the best practices developed anywhere in the country or the world and spread them instantly and wisely.
I mean, if you look at what Uber did in transportation, it wasn't just that they allowed you to request a car from your phone. It was that they made sure that they were matching supply of drivers with demand from riders. Taxis couldn't do that.
Yeah.
Find a taxi. You know, we both live in Boston. You used to go in front of the Lenox Hotel or the Westin, and there was a taxi queue.
Yep.
But today, you're in Sherborne, I'm in South Boston, and depending on what's going on, they're matching rider demand with driver supply. And that's what data and analytics platforms are going to allow us to do in healthcare. How do you shift your supply and demand based on where there's the most need?
So what about a clinical perspective about technology and AI? We've heard a lot about it, but coming from that view, is it all positive?
Well, I think you have mixed answers to your question, so let me start. I went to medical school in 1980. Do you know a few things have changed since then? In my field of emergency medicine, 800 papers are published every day, and I'm slightly behind on my reading. AI and tools, predictive and generative, can look at medical literature, can look at best practices, can look at the care journeys of millions of patients. I'm only as good as what I studied in 1980 and the patients I've seen since then, 10,000 or so. Well, I can now benefit from millions of patients' life experiences because I'm given best practices, probabilities, and models. It's math, not magic, but it can help me be a better doctor.
Love that.
I think that that's actually a really great point, is the modern healthcare system and our research network has generated so many great evidence-based practices, but it's impossible for anybody to stay on top of it. And so I think what's most exciting to me about the adoption of AI and the implementation of AI is creating much broader ease of access for physicians, for patients alike, to be able to use and adopt that new evidence in a way that's going to benefit society.
And ultimately getting to the point where it can be completely trustworthy, because I feel like that's the part of the momentum that's a little stop and start in terms of figuring out how it works and allowing people to believe it, because making a mistake like that is a life and death issue.
Absolutely.
Can you guys give an anecdote where AI was incredibly well used or hugely successful in your own experiences in this world?
Sure, so let me give you a couple of quick Mayo examples.
Great.
My father-in-law died 13 years ago of stage 4 pancreatic cancer, which by 2030 will be the third most common cancer in this country. Stage 4 pancreatic cancer is not curable, and we can't detect by human eye pancreatic cancer until a late stage. Mayo has developed an algorithm that diagnoses patients 2 years before a human can at stage 0, when they can be treated and cured. And we've seen similar evidence in GI endoscopy. 5 times better performance when a human is augmented, not replaced by AI, but augmented by AI. Earlier diagnosis and more cures.
Wow.
That's what will result.
That's a great example. Michael?
Most physicians that I know would not say they got into medicine to be data entry analysts or even data analysts, but I think over the last 20 years, we've put a lot of burden on physicians to capture and document in a specific way, whether it's payment methodology or federal legislation. And that's all well intended, but it's created a tremendous amount of pressure and burnout in our clinical staff across the country. One of the things that I've been excited about with the implementation of AI is really getting clinicians back to their core mission of making people healthier. We've seen administrative tasks, documentation, clinical documentation for billing, to be reimbursed the services provided, compressed by 20-25% through some Copilot implementation with our customers. And that's been a huge lift of the satisfaction of clinicians and caregivers because they're able to spend more time with patients. And by the way, when clinicians are happier, so are patients, because that can be felt by their
Right,
patients.
you can feel it.
So you see not only time saved, you see better patient satisfaction and better provider satisfaction, which is a win across the board.
We actually had someone that we interviewed who spoke about the fact they had a ambient AI company that was helping doctors, and literally they had a doctor come up to them and say, "What am I supposed to do with this extra 2 hours?" And we're really excited and a little overwhelmed to have it.
It's an interesting point, though, because I think a lot of hospital executives, drawing on your earlier point, say, I want to implement ambient to allow my docs to spend more time with patients. But a lot of time what those docs are getting is more time with their families, which allows them to stay in medicine longer versus leaving medicine and going and pursuing another career.
Well, exactly what I was going to say. So we deployed an algorithm at Mayo that does pre-computing of radiation oncology treatment plans. And a radiation oncologist emailed me, "I've had dinner with my family every night this week for the first time in 5 years."
How much does it cost to replace a radiation oncologist?
Well, there's direct costs and indirect costs. Let's just say it's going to be north of $1 million.
Wow.
And that time that they're spending with their family, if that's avoiding direct and indirect costs of $1 million, that's transformative to our healthcare system.
I also appreciate the fact that quality of life is actually being considered a variable that's been taken seriously in careers. And I think that actually came out of COVID a little bit.
I do too.
You know, people just recognizing that a lot of stuff can get done, even if people aren't showing up in a very regimented way all the time. And giving credit for people to do the right thing kind of gives me a moment of like, go humanity.
Yay!
Hooray! Here we go, party! So where do we see the biggest opportunities for data and AI?
I'm pretty excited about how AI can be used to help really take the tailwinds of the work that's been done by Da Vinci and FHIR and a bunch of these other interoperability work groups who've really helped democratize access to data. And now having an AI filter to draw insights from the data, I think it'll allow us to have a much more responsive, a much more personalized healthcare system where precision medicine can be democratized to care providers and to patients. I think about some of the medical documentation I get, whether it's from MyChart or other products. Having a layer to interpret that for me as a co-pilot will drive my patient satisfaction. And I think we're finally at a point where you can bring together these threads that so many smart people have been working on for a decade to really advance our industry, not just a step forward, but a real leap forward.
Love it.
And I was one of the first patients sequenced in the Human Genome Project. And today, 15 years later, has my healthcare been materially different because of sequencing? It has not. And why is that? Because interpreting the human genome, the mutations, the biomarkers, is hard. So could you imagine a generative AI system trained on 100 million patients that takes full genome sequences, medical records, phenotype, genotype, exposome, and says, you might want to consider this lifestyle change, this medication, this diagnostic test. Mayo's building that right now.
Yeah, you two are seriously at the forefront. Do you think that is possible in terms of happening? And what do you guys think the time frame would be in terms of something like that really becoming the norm?
We'll have it done this year, so I'll let you know how it goes. But as you suggest, I imagine we're 3 years or so away from the standard of care being fundamentally changed so that AI becomes part of many specialists' workday.
I agree with that. I think the other thing that I'm pretty excited about is within 5 years, you're going to have a major health system that tells physicians you don't have to touch an EMR. And I think that's going to drive a ton of efficiency, a ton of productivity, and a lot more satisfaction with the caregiving experience.
Well, I will say, being at HIMSS, it's certainly clear there are a lot of people trying to get to that next place, and how exciting the energy has been, including the energy of you both. Thank you so much for being here.
Thanks, Kate.
Thank you so much.
Be sure to catch the companion HIMSScast podcast with John and Michael for more emerging technologies' impact on future healthcare delivery. From HIMSS TV, I'm Kate Milliken.